Good morning, good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your medical tidbit of the morning. I promised I would talk about cervical cancer, especially HPV vaccination. I did give a brief overview on cervical cancer yesterday, and this is really about an urgent focus for Black women. And you said, you might ask, why does vaccination matter, right? And I know there's a lot of controversy now about vaccinations and this and that and that. I'm putting out, medical and scientific facts. All right. The fact is, most cervical cancers are caused by a persistent infection with high risk human papillomavirus types. Right, and it's very commonly transmitted sexually. Right, there are 9 variants. Right, sorry, actually no, there are more than that variants of HPV. Okay, so the HPV vaccine has been around. It protects, I think, against the most dangerous HPV strains. Right, so that's important to know. Right, when uptake is widespread and timely, the vaccination can dramatically reduce your rates of precancerous lesions, right? And over time, decreases your chances of any invasive cervical cancer. But like I stated prior, Black women bear disproportionately higher burden of cervical cancer, right? Black women are 41% more likely to develop cervical cancer and are 75% more likely to die from it. These are real statistics. And mortality rates for cervical cancer in Black women are roughly 65% higher than for white women, right? So that's real. That's a real number. That's a high number. Okay, so we need to take that and take it very, very, very seriously. So this disparities, like I mentioned yesterday, is not from genetics predominantly, but from inequity in terms of prevention, your diagnosis, your treatment, your follow-up care, right? So we need to address this disparity. Equitable access to HPV vaccination is critical. And it's lagging significantly in our community. Among females aged 19 to 26 in the US, 50% of non-Hispanic Black women have received at least one of the HPV vaccine, compared to 60% of non-Hispanic white women. I want you to listen to this data. In 2019, about 47% of US adults ages 18 to 26 had received the HPV vaccine. Right? In a study of adults 18 to 26, the same age group, only 24% had received the vaccine. These are sobering numbers, right? So among adolescent girls, vaccination initiation and completion rates are much lower in Black girls compared to some other groups, right? And listen to this, 80% of Black girls had initiated the series, but only 60% were up to date. So 20% was lost in between, right? So in terms of structural barrier, only about 25% of Black women report that a healthcare provider ever recommended the HPV vaccine to them. That's a problem. The healthcare provider is not even bringing it up to these women. So there's gaps. There's gaps in outreach, there's gaps in education, provider recommendation, and system level support. Okay? So this delay has to be addressed. We need these vaccines, right? One study showed that among women with early stage cervical cancer, 80% of black women receive surgery versus 92% for white women. So I know there's vaccine hesitancy, especially since COVID. There's a lot of misinformation, and you put the trust issue that we've had, that compounds the issue. So we need to look at this, and we need to solve these problems for ourselves from within. Okay? The providers, the clinicians, you are responsible to actively recommend the vaccine. Explain it to them. If we want to see these mortality statistics improve, that's important. We need to be monitoring. We need to be more data driven, especially in the Caribbean. And there has to be continuum of care. The screening has to be better. Women can't be waiting 3 to 4 months to get a pap smear result. And you, the patient, has to take that initiative to follow up also and be responsible for your health. So HPV vaccination is an important tool. It's a powerful tool to prevent cervical cancer. We are lagging in that education, in that access, poor communication, and we need to look at these numbers, these statistics. They're more than numbers, that I'm speaking. These are lives. These are lives. These are friends. These are sisters. These are mothers. All right? And the fight against any cancer where there is injustice is a fight for equity. I know people hate that word. I call it a fight for health justice. I want folks to hear me and what I'm saying. And let's do better as a community, right? Start looking out for ourselves. Anyway, I gotta run. Have a great day.